Well, today did not go as expected. Um, we had a really long night. Taylor kept having sleep apnea alarms where her sats are dropping down into the low to mid 80s, even with 1 liter of oxygen on her. And um, just a long night. She's still sleeping. It's like midday. But the previous 2 days she had been just catnapping here and there, so I'm glad to see her sleep, especially with her heart rate being in the mid 80s. So that's good, not in any pain and comfortable. Today, though, we had a 1 o'clock appointment that they canceled. It was with the ENT department at Nationwide Children's Hospital. Taylor has had her trach and her vent. She got them both at the same time. 15, maybe even 20 years ago. She had spent a couple months in the ICU, and when she was finally stable enough to get the tracheostomy done, Dr. Willett from Ohio ENT came the day before Thanksgiving and did the surgery. Then she had to stay and wait for the ventilator company to get a vent, and I wasn't a nurse then, so there was a lot of learning, a lot of training. She came home on a ventilator called the LTV 950, 850. Yeah. It's not what she's on now. Now she's on the Trilogy, but those were kind of complicated machines to troubleshoot, especially when you really... I spent a week at the hospital just watching YouTube videos and reading manuals, basically, and then asking any respiratory therapist that I found that would answer any of my questions, knowing that once she came home, it's on me. It's none of the nurses that I had were trained on ventilators at the time, so it was a big learning curve for all of us. Anyway, she had her appointment scheduled today because the last time her trach, the trach tube goes in the trachea, and that's where the breath comes from. So this is not where breath is coming from anymore. She is able to take her own breath, but the ventilator initiates a lot of them, or some of them. It basically just maintains the pressure in the lung for her by not letting her fully exhale, so she has a chance to actually exchange oxygen in the lower lobes. That's basically what we're doing. Train of thought. So the appointment today was to see, that was it. So I was hoping to get a trach tube changed because I've done it once here at the house, but she has a complicated airway, so it's best to be done in an office or a clinical setting somewhere. And the place we had been going, the doctor retired, and so we've seen another doctor there, but it's like a half-hour drive. So when anything goes wrong with the trach tube, like this last time, the cuff is like a swimmy for your arm. Yeah, so it takes up, not for your arm, but it goes around the trach tube to take up space between your trachea and the tube to keep air down. So when it stopped working, her tidal volumes, the number on the machine that tells me how much pressure is being maintained in her lungs, was well below acceptable. So I had to take her into the emergency room, and the doctor there did a botchy job at it, even with me assisting, which wasn't great because I wasn't expecting to help her, and I didn't have gloves on or anything. It was quite traumatic, actually. And she damaged her airway. There's a lot of blood. So we came home with her still bleeding for a few days. So I wanted to get her established at Children's ENT, so when we have to go to the emergency room, we have a chance of a doctor being familiar with her and her care, or at least able to read a chart about her airway. The guy we had scheduled with doesn't do trachs. The trach has their own clinic, the trach clinic with the ENT department, and I was told that it's instead of the obturator, the little guide to go down when you replace the tube. It works better to use either a Cook's catheter or a Bougie catheter. And I got a call back saying that just sounded too complicated for them. So since she's already being seen by another physician, we should just go back there. So she did not have her appointment today, and I called the half-hour away place and got her appointment, luckily for Friday. So the fact that she's sleeping all day today was actually pretty good timing that they canceled it. So hopefully she wakes up soon. Otherwise, we're not getting to bed till 4 or 5 in the morning. See how it goes.